Well, good morning, everyone. I'm Mark DeCourcy, the Senior Vice President here at the Chamber Foundation, and we're here to talk about collaborations in health. I'm delighted to be joined by three people who are really making a difference, not just here in the greater Washington, D.C. area, but in other places across the country. To my left, I have Jennifer Duck. She is the Vice President of Public Affairs at Novo Nordisk. Derek Perkins is next to her. He is the Market Executive for Bank of America here in the greater Washington, D.C. area. And then Scott, all the way down the end, Scott Kratz, he is the President and CEO of Building Bridges Across the River. And we have a great project that you saw a little bit about on the video that we wanted to talk about as an example of what's possible when different organizations collaborate. And we talked about the interrupt. Right? It's a word that you're probably wondering, what does it mean? What does it do? And I think the first question what we want to do is tackle what it is. And Jennifer, would you share with the audience, what is the interrupt?
Yeah, thank you, and thanks for having us all here. It's nice to be up here with all of you. The Interrupt is a platform that we put together to really bring all of our efforts to cross-functionally address community health and lift up what's going on across the country. And so I think it's really exciting. We were trying to figure out at Novo Nordisk, how do we have a bigger impact with our charitable giving? And we came up with a strategy to really focus on chronic disease prevention. But we know, as well as everybody in this room does, that it's not just about food and nutrition, which was our focus, but it's about housing, it's about education, transportation, so many different functions and go into whether a community is healthy and successful. And even if Novo Nordisk became a 100% foundation and put all of our money towards it, we wouldn't be able to do it alone. But when we work with partners like Bank of America and others across the organizations, we can be much more successful, and Scott can show us kind of how to have a real impact in communities.
Yeah, thank you for that. And Derek, when you talk about health, and you think about companies who are addressing health disparities across the United States, you don't first think of banks. But here you are, Bank of America, making a huge difference. Tell us about that and how you're getting involved and what superpower Bank of America is bringing to the challenge.
Well, again, thank you, Mark, for having us today, and thank you, Jennifer and Scott, for joining me. And I will say, Mark, before I get into answering your question, I want to say thank you to you because of the conference, I think it was 2 years ago, that we did here at the Chamber. I met Apu at Novo Nordisk. We started talking about the work that we were doing and figured out, well, hey, I'm doing this thing and you're doing this thing, and maybe we can do these things together. And so, thank you for that, for bringing us together. So I really appreciate that. And to your point, I don't know if we necessarily have a superpower per se, but one, we want to make sure that we're impactful in our communities in which we live and work. And so that's near and dear to Bank of America. And then, on its face, it's pretty basic. Healthy communities help drive business, right? And so for us, we want to make sure that we're in a strong community to help drive business. And finding good partners like Novo Nordisk, who is doing this work already and that we can partner with, for us was great. And then, when you have nonprofit partners like Scott at Building Bridges Across the River, it makes it's really what drives the work, right? And so Novo's working with Scott, we were working with Scott. It's like, well, clearly Scott needs to be a part of this conversation today, but also at the work at Washington View.
Yeah. So Scott, tell the audience, what is Washington View? What was it like? And what you are doing to make a difference there with building these bridges across the river? And kind of, what is the vision of what it's going to be because of partnerships like this?
Yeah, so the nonprofit that's my honor to lead, Building Bridges Across the River, we serve the east of the river communities. So those who might not know Washington, D.C., Washington, D.C. is very much divided by the Anacostia River, and every single data metric that you could look at, there's great discrepancy. There's a 20-year life expectancy gap depending on where you grew up in Washington, D.C. Think about that, 20 years, right? So What we're doing with Washington View in the collaboration with with Bank of America, Novo Nordisk, and others, is Washington View is a place-based approach to really tackle the larger social determinants of health and break down some of the silos that sometimes traditionally we've addressed those issues. So Washington View is a affordable housing development, 353 units, about 2,500 residents, where we've brought in sort of best-in-class funders and best-in-class nonprofits to collaborate to serve and connect these initiatives. So I'll give you a couple examples. Food access is a huge issue east of the river. There's only one full-service grocery store east of the river serving 75,000 residents. So we built a farm that's on site. Food that's grown on site, where we hire local residents to work on that farm, is then harvested on a weekly basis and distributed at no charge in a fresh market that is on site, that's open 2 days a week. But if we need to tackle more than just food access, we need to tackle workforce and building opportunities to build intergenerational wealth. So we just graduated our 3rd construction training program on site. So we've seen dozens of residents who've now gone through our construction training program and now have been employed in jobs, right? So if you take these, what seemingly would be disparate connections of workforce, of food access, of health access, Bank of America has been supporting a collaboration with American Diabetes Association and Black Nurses Rock to do health screenings. We're just about to launch I'm happy to, I don't think we've said this publicly, but the Marriott Foundation, we've heard great news, will bring on additional partners with a $1.4 million investment in Washington View, right? So we bring sort of all of these resources to the table to connect the dots to make a much bigger impact, right? Because we need to recognize that we are stronger together.
So can we stick with that for a second, Scott? And this collaboration called the Interrupt, when they first came to you, were you skeptical at all, or were you hopeful? Like, what was the emotion that you had that companies wanted to work together to help support your efforts?
One word is relief, I think. Because like we're out there, we have to raise money every year, and often it's these sort of single conversations that we're having. So to be able to connect the dots, to be able, most importantly, to connect the dots for the residents that we serve, right? Where if we identify a challenge, we identify, I'll give you an example. One of the programs we're looking at of how do we bring this to the table with Washington View, we've been running a home buyers club for the last 7 years that have helped 182 Ward 8 renters become homeowners, building intergenerational wealth. How do we bring homeownership opportunities, right, to Washington View? So it's for us, it's been at our DNA. We are a convener. We're about partnerships. We're about bringing folks together to better serve the community. So and we're just getting started. Like, we're barely in the first year. We haven't even hit our first year mark, right? So imagine where we're going to be in year 2 and year 3, where we're working with the community to identify additional needs that are there and bringing in additional supporters as well as nonprofit partners to better serve the community.
So this is where I'm going to ask all of you a question. How many of you are in a partnership with multiple companies or corporations on some sort of social impact effort? Okay, like maybe half. That's nowhere near enough, right? And this is a model that I think everyone could look to say, look, we can find companies that want to work together, and it doesn't have to be companies who do the same exact thing. Maybe it's better that it isn't. But the fact, Jennifer, that Novo is working with Bank of America, if someone were to ask you that 5 years ago, what would your reaction have been?
I would have been dumbfounded, right? First of all, you'd be like, wait, I don't even understand the connection. How would we get there? I mean, I think when we were first talking about the Interrupt, we were trying to think of different industries that would have similar interests in their charitable giving and in their social impact work. And so we were trying to think of like fitness and food, but it is one of those things when once you start kind of opening the aperture and realizing exactly what everybody else is doing and seeing the good work, like you guys, everybody who raised your hand, even those who didn't, your companies are doing incredible work. And what we're all asked for when we do that is, what's the return on investment? Why should the company keep giving this money beyond just it's the right thing to do? And when you work with other companies and you work with organizations like Scott in Building Bridges, you actually can say, here's the impact of our money, here's why this matters. And for a company like ours, Novo Nordisk, where we're trying to treat chronic diseases, the idea of preventing chronic diseases is even better. And I just am looking at these maps, and if we want to have an impact on these maps that are around the room, we can't do it alone. And that's why the Interrupt is so exciting, is it brings together all these different ideas, and it's not about like, how do you fit into the Novo Nordisk view of prevention, or how do you fit into Bank of America's view on driving the economy and driving business and driving economic growth in different communities. It's how do we together make a change on these maps.
And Mark, could I sort of jump in on that piece of it? And Jennifer touched on it earlier. We had started this work 3 years ago, sort of looking at the entire district. And then I thought, well, we can't really boil the ocean. Let's focus on one affordable housing project. And so we started doing that work, and we were doing a couple of components of it, right? We were focused on health screenings and sort of health outcomes, and then some food access. We were doing that. But when I met the folks at Novo Nordisk and they talked to me about the Interrupt, they were like, look, we're going to come in and we're going to plug into this gap. And oh yeah, by the way, we're already working with one of your good partners. So it just made it easy. It made it seamless to sort of fit into the program. We do what we do, and we continue to focus on the things that we're focused on, led by American Diabetes. And then Novo Nordisk sort of brought their wraparound piece to it, and now Marriott's going to bring their piece to it, right? Because as we continue to talk, we talk about all these social determinants. There are things that need to be addressed that we might address through our philanthropic giving and our support that Novo might address, but then someone else has another component, right? And this is all to really serve the community and serve the residents. And so it just worked so well for us to join this partnership.
So can we stick with the two of you just for a minute on this whole notion of shared value? And I've been around long enough that I know there are people in companies who don't believe in that. And there are people like us who do. What do you say to the skeptics that, no, this goes beyond philanthropy? I mean, there's something in it for all of us.
Yeah.
But,
I like the question, and it's funny because I almost wanted to jump in before you even asked it to be like, yes, and. What I like about all of this is the integrity that it brings for all of our companies. I mean, you know, we all have to deal with a skeptical public, and we all are skeptical members of the public, and whether we're hating a politician or hating a company or hating our neighbor or whatever, we actually, I believe, are all really ultimately good people who want the best for society and want the best for our communities. And so what's nice about the Interrupt is you bring your own agenda in terms of which part of the problem we want to focus on, which part of our expertise can we bring in, and then you take away the self-interested, cynical part of it by being under this umbrella of the Interrupt. It's not about how is Novo Nordisk trying to make Novo Nordisk look like we're the good guys. We're actually just trying to figure out how we make a difference in communities.
Right. And I'll just jump in there. Our CEO, Brian Moynihan, likes to say the genius of the and. Like, we can drive profits and impact communities in a positive way, right? And so those things aren't mutually exclusive. Having health communities is better for all of us. Like, we have better workers, more focused workers, more attentive workers, less sick days, so they're more productive. So there's all those things that sort of are an additional benefit to what we're doing, right? And we get to impact the community in a positive way, right? And we get to build stronger, healthier communities. And again, you get to do it with partners who have their own focus. It's not about, well, what is Bank of America doing? What is Bank of America getting out of it? It's about how do we improve the community, right? Like, there's an opportunity and there's a space for companies to do those things in community with people like Scott and people like National Housing Trust and Black Nurses Rock and American Diabetes. There's all these groups that are doing this great work that we get to support.
Yep. So Scott, on this, from the client perspective, from the people that we're trying to help, if just one company came and said, hey, we're company X and we want to do Y, versus a coalition under an umbrella brand, how is that received? And is the one better than the other?
Yeah, I'd say the genius of this collaboration is it's a force multiplier, right? If it was just one company coming in, there's impact, but that can be limited impact, right? But this bringing in multiple partners, multiple skill sets, multiple talents together, it can expand that initial investment. And the great thing is, I think even though everyone can bring in their own sort of special assets that they bring to the table, everyone can take credit, like each partner can take credit for the entire investment, right? Which is huge. And I think from the resident perspective, which is what gets us up in the morning, just like all of us, we don't live our lives in silos, right? I mean, every day we're thinking about our financial health, we're thinking about our physical health, we're thinking about our environmental health, we're thinking about our kids, we're thinking about education, right? And so by connecting the whole person, by connecting these investments that support the entire community, that's huge. And what we found, which is interesting, is communicating that to the residents, the 2,500 residents who live there, is really essential. Because if each nonprofit was coming in, doing 30 different interventions, it would confuse the heck out of the residents of just like, wait, now there's a farm, and now there's a pantry, and now there's workforce, but all of these are connected, and the residents now are starting to see that connection. We're branding that, right? So all of our staff for all of our nonprofits wear the same T-shirts, View Strong, powered by the Interrupt, right, with all of our collective logos on the back, which is important. And just last Tuesday, we started a new initiative as part of this, the intervention, where we've brought on staff residents, hired staff residents as ambassadors for the program, which is really important to do two things. One, be those trusted sharers of information, right, conveyors of the different programs, but just as importantly, provide a feedback loop of what are we getting right, and what are we getting wrong. So one thing that we heard is, we're coming up on the holiday season, and there was. And I was just reading an article this morning about turkey prices going through the roof, right, because of avian flu. So what we're doing is we're providing 150 turkeys and all the fixings on November 20th to all of the residents in Washington View. And all of the partners are going to come together wearing our same T-shirts, sharing about what's the next workforce development training or American Diabetes Association screening, or Unity Health, the connection to mental health services. So the residents start to see this larger connective tissue as well.
Well, I love that whole notion of same T-shirt, one
It's a larger
team.
metaphor. Yeah.
Right. Okay, so Scott, you've got a few things covered with generosity from Novo and Bank of America and Marriott Foundation. What are you missing? Because I'm looking at the audience, and they can fill a lot of those needs. What else do you need?
Yeah, I think when we think about that whole person, we think about the whole family, right? What are the sort of individual and collective societal needs? When we're thinking about Washington View, there's a few different things that we've been thinking about. One is there exists not only a geographic divide, but also a digital divide, right? So where there might be an opportunities the east of the river has a real lack of access to broadband, right? Which we know is essential to really engage in our economy, whether it's applying for jobs or what have you. Continued interventions in youth education is really important. East of the river, although it's getting a lot better, the east of the river has the highest rates of violence in this city, right? So where is there an opportunity to have positive connections to the youth that are there? The east of the river, Ward 7 and 8, represent over half of the kids that are in this city, in the nation's capital. So where is there an opportunity to bring things like basketball leagues, when the sports, opportunities that are there? We're expanding, working with Bank of America, we're expanding on some of that work with financial literacy, right, to make sure there's a strong foundation for those families that are there. And thinking broadly about education, I think particularly for youth, but I think for the entire family unit.
So, Derek, you have colleagues all over the country who have similar jobs that you have, and they're running the Bank of America operation in these major metro markets. What are you telling them, and what are they saying back to you around things like the Interrupt and the partnerships that you've been involved in here, and the progress that you've made in helping organizations like Bridges Across the River?
Thanks for that, Mark. Like, I will tell you, one, they're excited. I had an opportunity to address sort of our largest 20 metros. So the metros you can think of, DC, New York, LA, those metros. And a lot of those metros are already doing some of the health work, and they were doing it not necessarily alone, but not necessarily in partnership, in concert with a group like the Interrupt. So I had an opportunity to talk to them about that. And so we're already getting engaged in Philly with some of the work. And the goal is to now move it to those other markets, right? Because it makes the work a lot easier. You can get a lot more done. I want to touch on something Scott said, like he touched on mental health. That's something that I actually wanted to do initially, but when I was looking at my initial rollout, I was like, well, I can't quite get there now. Well, now we have a partner who's going to come in and do that work, right? And that's what the Interrupt can do. You can figure out how to get others involved in it. And this is sort of a platform which you can just sort of plug into, and that's what my colleagues now know, that this is a platform they can easily plug into. It's up and running. I wouldn't call it sort of plug and play, but it's getting close, and I figure in another year or so we'll be in a plug and play model. Hey, these are the things that we're working on. This is what our lane is, and this is where you can plug into the work. And so that they're excited about.
And Jennifer, this isn't the only project that Novo Nordisk is involved in. Can you tell us a little bit about what else is going on across the country?
Yeah, thank you. And it's like you read my mind every time that I'm about to jump in on Derek's answer, because I was just thinking about the work we're doing in Alabama with the University of Alabama. We were just there last year, and they've been doing a lot of work on food and nutrition and bringing in healthy fruits and vegetables throughout Birmingham, and they were expanding to Tuscaloosa and then also to other areas throughout Alabama. And we were really excited to be part of it because we were going to be investing in a new park that was going to be created in the neighborhood while others were bringing in health services. And then because we were there with the University of Alabama, Birmingham, and we were showing that we were going to invest, the local Alabama Power and Light came in and provided lights for and lighting all the way on the streets and then through the park. The construction companies in the local area were providing the materials. We were able to get a whole group of folks together in order to really make a difference in that community. We've also been doing a lot of great work in Oklahoma and South Dakota with and South Carolina with the Native American populations, and what they've been doing in terms of trying to, again, we focus on food and nutrition and connecting food systems. And in fact, since 2022, when we started this effort, we've either spent or committed over $50 million to these efforts across the United States. And we have projects in 22 states. And it's really exciting because it's all work like what Scott's doing. And we work with the local communities and the folks who know who else, like who should you be partnering with? Like, it's not for us to come in and say, it's for Scott to identify who are the nonprofits, who are the folks in the community that they trust that we should be engaged with. And also helping us meet and connect with Derek, or with the chamber, having us connect with all of you to say, oh, well, we're doing this in this neighborhood.
You're reading my mind now. Yeah, and that's kind of where I was going to go next. And well, I always say this, and you look around this building, right, and you look at the name tags, and there's lots of Fortune 500 companies in this room. That is a good thing, but it's also a challenge because there's only 500 Fortune 500 companies. They can't do everything everywhere. But when you think about local businesses like you did in Alabama and what they can bring to the table, it can really be a game changer in these communities where there is not a huge corporate presence. And Jennifer, I was just wondering, like, how did you even approach them where they're like, Novo Nordisk, like, we don't know much about that company, but their intentions are spot on what we're trying to address here in this community. Like, how did you bring it together? I mean, that's a big challenge, right? But you were successful.
Well, I mean, I can't take credit. I've got an amazing team with Apu and Kate and Dana and Leslie of folks who are doing that. And what they do is they go to events like this, they come to the chamber, they go to different conferences, they meet folks like Scott and like Derek and different companies, and they find out kind of who's doing what and where are people making a difference and how can we connect with them. So, luckily, we've got a really good group of folks who are already networking, engaged throughout the United States. We've got one organization that we work with in Southern California, and it just so happens it was a guy in the neighborhood who was like, hey, I'm in Southern California and there are fruit trees everywhere and it's all just going to waste. So he started going around and collecting the fruit and vegetables from his neighbor's yard, and now it's this huge organization, and it's moving millions of pounds of food from Southern California, from the neighborhoods where it was just going to rot on the trees because you can only make so much jam, and getting it to the food pantries and the different communities that need fresh fruits and vegetables. So it's really the networking that makes a difference.
And Derek, same with you. I mean, Bank of America actually has physical presence in so many communities across the country, right? I would submit that that is a superpower in itself. How do you and your colleagues activate on that to do projects like this?
You're right. That we are operating in 97 markets around the country, which covers virtually the entire country. But the idea is that we take the scale of this really big bank and we try to drive it locally, because we've decided that local decision making matters, right? To know who the partners are to connect with. So like I think about Scott. Scott has the ability to be a credible messenger in Washington View, right? So Bank of America showing up in Washington View, or Bank of America showing up anywhere in the communities without a credible messenger, right? It's taking a little caution. I don't know why, but everyone doesn't feel warm and fuzzy when I show up. However, when you have nonprofit partners that are already trusted, that are already doing that work, and we have it again around the 97 communities around the country, like they bring that message, so then we can support the great work that folks like Scott and other nonprofits around the country are doing each and every day.
So Scott, if somebody in this room wanted to help you, how do they do that?
What's really exciting, I'll answer that question directly, but I think what's really exciting about this is building on the work in Alabama, now in DC, now at Washington View. This is still in the pilot phase, and what that means is that we are building a replicatable model, right? We are building a model where we're already looking at other communities in Washington, D.C. to make this kind of place-based investment, right? So because we're the nation's capital, right? This should be the place where we get this right, or at the very least, we shouldn't be making the same mistakes at the same time across the country, right? So I think if folks were interested in saying, hey, I have something to bring to the table, I have a data visualization, I have athletic company, I have the broadband, I have education, X, Y, and Z, right? Or you work with nonprofits, right, that are already sort of working in Washington, D.C. or working nationally. They're looking for a connection where that can fit. Reach out to us, right? I mean, this is only the beginning. This is a minimum of a 3-year commitment. So, and that's really important, I think. And I'll just give a little the credit to the two here of Novo Nordisk and Bank of America and now the Marriott Foundation. Oftentimes in communities, there is an enormous and justifiable trust deficit, right? Because people have come in and then the grant money goes away and then they leave, and sometimes that does even more damage than the original intention, right? So making this sort of multi-year commitment where we can build on that, we can build that trust, because trust is about shared experiences over time and keeping your word, right? Allows us to leverage this foundation that we have to continue to put these more investments. So reach out to us, reach out to Bank of America, reach out to Novo Nordisk, and join this sort of larger pilot as it replicates across the city and across the United States.
And I will be that person. Go to theinterrupt.org and join.
So we're almost out of time, so I was going to let Derek and Jennifer have the last 2 words here. The audience has had a lot of information thrown at it for the last couple hours. This is a long 2 days of great content. Derek, Jennifer, if you wanted the audience to remember one thing about this partnership and how they can replicate it, what would it be?
Go ahead.
So I'll start. I think, one, the outcome, focus on the outcome, focus on the center of the people in the community that you're impacting. And then two, something that when I started working with the team at Novo Nordisk, we didn't get bogged down into who needs to own what. Right? We got focused on the results. Like, how do we get to the result? It wasn't about, well, what is my brand? How does my logo look here? How does my logo look there? It wasn't about all those things that Apu and I used to joke about, well, I know our comms and our legal folks will do their thing, but we're here to do the work and fund the work. And so we didn't get bogged down on why it couldn't work. We focused on how we're going to make it work and how we're going to put these two brands together under this umbrella.
And I'll go with the two words of join us. We're stronger together at
Well, the two
theinterrupt.org, and we can really make a difference and have an impact on these maps. So thank you.
Thank you. Let's give it up for the panel.